If I wouldn't have been part of the Medicaid reform plan, Alan wouldn't have been able to get all the help that he's getting right now. This is Alan when they were born. He was hooked to a ventilator, and this was Anthony on the incubator. They were in ICU for a month. Even the premature diapers were big on them. They came home when they were 4 pounds. They're miracle babies. One of the twins, his name is Alan. He has a lot of health problems. He has a tumor on the pituitary gland, and it affects the front lobe of his brain. He has heart problems. He's due for a catheterization in 2 weeks. He has a growth problem due to the tumor. Growth problem is affecting his right leg. He's growing more on the right side than on the left, so he's getting a small surgery for that. Alan was about 11 years old when we found out that he had the pituitary tumor. The Medicaid reform has been a really good experience. It's been a great help to me. Kathy's been very important part of my family because she has always been there to help me.
With Alan, because he has numerous problems, trying to navigate his appointments and helping Mom navigate those appointments is important, because he does follow up with an endocrinologist, a cardiologist, an ophthalmologist, psychologist, just to name a few. Working as a case manager, you're working one-on-one with that patient, so you're building up a relationship with them. You're just as important to them as the doctor is.
I think now that we see that care is being better coordinated, oftentimes we see that specialists and other providers are actually more willing to see patients with Medicaid reform versus old Medicaid. Though one thing that I think people should know about Medicaid reform as compared to old Medicaid is I think it's a step in the right direction of having patients and physicians working together. It truly does prevent a lot of unnecessary, uncoordinated care. As part of Medicaid reform, I think we definitely do see a benefit to the practice in that patients are coming in more regularly to be seen for their visits. They're getting their visits on time. We actually spend less administrative time trying to contact patients, reach them, do callbacks, reinforce the care that's being provided.
What I really want is for them to grow as healthy as normal kids. I want them to be able to have good health and be able to go to school, start their own families, and be successful.
I want to be a violinist, and my hobby is a skateboarder and a musician.